So this is our new monitor, the Vetspec PM100. Okay, we're gonna learn how this works. Okay, go for it, Chris.
All right, so you turn it on this side of the machine.
Okay.
It's turned on here. The end-tidal CO2 monitor gets turned on right here. You have to, it's a long hold.
Okay.
So you have
Long
to push
hold.
that one.
Yellow button. Okay.
Pretty hard. You use these little cables, which are located on this side of the machine, with this white piece attaching to the top, and you push it pretty firmly in and twist to lock it into place.
Okay.
Then you'll need this little adapter for attaching it to your ET tube.
All right.
And then it just connects to the patient that way.
So does it comes right off the patient ET tube?
Yep,
and then,
ET tube and then into, just like that.
Okay, piece of cake.
On the patient.
So it's
You
a
have
little
to make
ball-shaped.
sure that your ET tubes are not long. It will malfunction if your
What do you mean
ET
if it's-
tubes
oh,
are
you mean if
too
it's like
long.
hanging,
It
you know?
needs to be at the canines or just right there. So this needs, your ET tubes, you need to make sure they're short
Okay.
for your patient. And then you will have some errors with these. If it gets too much condensation or something like that, you can, it will automatically try to clear the line, or you disconnect this piece during your procedure and there'll be some condensation here. Just wipe it off, knock it out on the towel, and then reconnect it. And then to stop the alarm from alarming, you just push the alarm button and then wait for it to start picking up the respirations again.
Okay.
In the event you have a super long surgery, you may need to change this out to a second line during your procedure, which we have those here. So, and then, so that can stay hooked up here. You'll have all of your connections should be connected here on this side, and I did have them color coded for the SpO2, respiration, and the ECG and temperature probe.
Okay.
This is the blood pressure cuff. It doesn't work on all patients if you have too short of legs, because this needs to be put on below the cuff, and so you'll have it below the cuff on the wrist.
Oh, so you're saying like if you have a dachshund with like micro legs, it's not going to work well.
And then you'll
Or if
have
at
your
all.
blood pressure cuff above it.
I get it.
With this portion right here being on the band.
Yeah. It'd be pretty hard.
Yep. So that's why this doesn't always work. And if you're not going to use it because you can't get it on your patient, you need to unplug it here, which is right here. Just unplug that and set it to the side, or it'll continually alarm
And drive you crazy.
and inflate the cuff, yes.
Okay.
And then you can just plug it back in. It's trying to inflate now. And then you have your esophageal ECG probes, small and large depending on your patient size. And
Cat versus Great Dane.
yep, Great Dane. I use these in any patient above 30 pounds, the large one, and then this is the smaller patients.
Okay.
And those just connect right here.
They disconnect or
Connect.
Okay.
So
All right.
super simple.
Yep.
And then I just hang it and
Do you
wait.
just leave it there most of the time? Just leave it? hanging?
No, I disconnected and cleaned every time.
All right.
So you have to select your own size every
Okay.
time.
Okay.
Your SpO2 monitor
Okay.
is right here. You do have a toe one. If for some reason your the surgery's on the face, you can switch it to the toe monitor.
How effective is that for a toe?
I've only used it once and it worked just fine.
Okay.
And then if for whatever reason you can't put an esophageal ECG on, we do have leads that you can switch out as well
Okay.
and use those
The
instead.
usual.
Yep.
Okay.
And then we also have the different size blood pressure cuffs here.
Okay. Do you want to talk about measuring blood pressure size so that people don't forget how to do that?
It should be less than 50% and greater than 30% of the circumference of the leg.
So take it here. I'll be a big dog. Do my wrist.
Your wrist.
Okay. So you have.
So
So she's going to measure my wrist and determine what's the right size.
I would go like that on the side or the top, and that one
Okay.
would be too small. And then you could take this one, and that would
That's
be,
like 50%ish, don't you think?
yeah. You don't want it 50%. That's
A little less than 50?
Yeah, you want it less than 50,
Okay.
greater than 30.
Okay.
Where this one wouldn't work.
Yeah,
so
that
we're
one's
kind of
like
missing
25.
a size.
Okay.
So you just kind of do what works best, or it has the range here. That
Oh.
if you were to wrap it, it has to fit within that, and see how it's like it's
Doesn't-
right there.
Yeah, barely makes it.
And this one doesn't have that. But
Okay.
Yeah.
Oh,
So.
sorry.
Yeah.
Okay,
this is
so
a
if you were to
little on the
choose,
big
you would
side.
choose the child size 9 for me? This one
Yes,
right here, the big
I
one?
would choose this one.
Okay,
And you can also change it and put it on the tail or whatnot
Okay.
if you can't find the correct size.
all right.
So it's pretty simple, easy, and all your stuff will come up right here. There's
And this
really
is all
nothing.
touch screen? Do we need to
This
do
is
mess
not
with this?
touchscreen. You
Okay.
should not need to mess with this.
Okay,
This is your start-stop for blood pressures if it won't start automatically, which
Alright.
it usually does. And then
we're gonna need
the
to change it.
alarm.
Just shut up.
Yep. And that's really all we use.
And
And
this, pulse and trend, do you know what
we
this
don't
is?
use those.
Okay, so just ignore them?
Just ignore them.
Start, stop, and alarm to stop
Yep.
yapping,
I mean,
shouldn't need to mess with any of this?
Shouldn't need to mess with anything. If you
Okay.
needed the menu, you can go there, but I've never
Okay.
had to use it.
Okay,
So keep it
Alright.
simple, and all the books are down at the bottom
okay,
for troubleshooting.
all right. And to reiterate, anybody who uses these, notice how none of them are tightly wound.
No.
These things, this is how you break these monitors, is by making them look neat and pretty. They need to be loose and flowy.
Yep.
Loose and flowy. Mhm.
And then
I was gonna say a white cotton dress, you know, but an intestine is also loose and flowy. Okay, all right. Okay, that's it?
that's it.
Okay.